Trauma can happen to anyone. An accident, loss, abuse, violence, or disaster. But when the mind and body can move on, even months or years later, it may be post-traumatic stress disorder, PTSD. PTSD isn't weakness, it's a normal brain stuck in survival mode after abnormal stress. Today's video explains what PTSD is, how to spot its signs, why it happens, and how recovery is not just possible, but absolutely real. What is PTSD? PTSD is a mental health condition that can develop after experiencing or witnessing a traumatic event. It's more than just bad memories. PTSD rewires the brain's alarm system, leading to persistent distress and difficulty living a normal life. Millions live with PTSD, including survivors of accidents, abuse, assault, combat, disasters, or even sudden loss. PTSD symptoms are grouped into 4 main categories: re-experiencing, flashbacks, intense distressing memories, vivid nightmares, physical reactions, sweating, heart racing, when triggered, avoidance, trying to stay away from reminders, places, people, conversations, numbing emotions, detaching from loved ones, blocking memories, negative changes in thinking or mood, persistent guilt, shame, blame, or hopelessness, loss of interest in activities, distorted beliefs about self and world, feeling emotionally numb, isolated from others, hyperarousal, easily startled, on edge, trouble relaxing, sleep problems, angry outbursts, constant alertness. Symptoms may appear weeks, months, or even years after the trauma. Not everyone has all symptoms. Their intensity can fluctuate. Why does PTSD happen? Anyone can develop PTSD, but it's more likely with severe, ongoing, or repeated trauma, childhood adversity, or prior mental health challenges, lack of social support after trauma, additional life stress, substance abuse, or poverty. PTSD is the brain's desperate attempt to keep you safe in a world that suddenly feels dangerous. Understanding the science reduces shame and opens doors to healing. Psychiatrists diagnose PTSD when symptoms last more than a month and cause significant distress or disruption. Detailed interviews, symptom tracking, and sometimes physical exams to rule out other causes are common before starting treatment. PTSD is treatable and recovery rates are high with the right plan. 1. Trauma-focused psychotherapy. First line. Cognitive behavioral therapy, CBT, especially forms like prolonged exposure, safely facing memories triggers, cognitive processing therapy, reframing beliefs, releasing guilt, or eye movement desensitization and reprocessing, EMDR. Sessions usually last 8 to 16 weeks, can be one-on-one or in groups, and often use gentle, gradual exposure to triggers, never rushing the process. 2. Medication. SSRIs or SNRIs, sertraline, paroxetine, fluoxetine, venlafaxine. These ease anxiety, insomnia, nightmares, and depression. Prazosin, sometimes used for nightmares. Other options, occasionally mood stabilizers or antipsychotics, are added for complex cases. 3. Self-care and support. Maintain daily routines, meals, sleep, exercise. Avoid alcohol or drugs, which worsen symptoms. Connect with trusted friends or support groups when ready. Don't isolate. Learn and practice relaxation tools. Breathing exercises, grounding activities. Mindfulness. 4. Additional supports. Group therapy for shared experiences. Family couples counseling for restoring bonds. Addressing co-occurring conditions, like depression or substance use, is key to full recovery. If PTSD symptoms become overwhelming, if there are thoughts of self-harm or suicide, or if daily functioning plummets, seek professional help immediately. There is always someone ready to listen and support. Never face trauma alone. Even after tragedy, there is hope. Recovery is not about forgetting the past but learning to live fully again. Thousands of people, survivors, veterans, care providers, find strength, joy, and peace after PTSD. Healing is possible at any age, after any trauma, and there is no too late for help. You're not broken. Your story is still being written with chapters of healing, strength, and hope ahead. Reach out, reclaim your life, and trust that light will return. PTSD is a wound, not a weakness. Step by step, hope pulls you forward. If this video brought you courage or clarity, please like, share, and subscribe. Because your story and your hope could guide someone else's first step toward healing.